So the next project is something that most of you, if you've been here for the last 2 days, you have likely heard something about it. Out of all of the projects that I've seen occur in gay men's health since I started, this is one of the most exciting and innovative projects that I've ever seen, and the coordinators of that project are largely here in this room, and they're amazing, and they're creative, and they're coming up with these incredible ways to engage their community. So I'm not going to say much more because I'm cutting into my dear colleague's speech. But Michael Kwag is the Advanced Community Alliance Director at CBRC, Community-Based Research Center, and works out of CBRC's satellite office in Toronto. Michael has worked in community-based research sector since 2004, working in CBRC's pilot of Totally Outright in Vancouver. A sexual health leadership program is now running in 8 cities across Canada, as you heard Jared say. And you can see that this is a little bit incestuous. We like to keep it in the family. Michael has also coordinated a variety of research studies and health campaigns engaging gay, bi, queer, and other men who have sex with men. Thank you, Michael.
Thank you, Aaron, and I'm fully cognizant of the fact that we are very late in the day, and I have the unenviable position of being the last presenter for the 2-day conference, so I will try and keep this as brief as I can. But it is really a pleasure for me to be able to present the Advanced Community Alliance for the second time today. For those of you who were in the morning panel, I'm going to have to apologize in advance for basically having the same slides. But given that the Alliance is such a great example of pan-Canadian collaboration in gay men's health, and that many of you were in other sessions during the morning breakout, I did feel it was important to make sure that some of the core information about the Alliance was communicated as part of this panel. That being said, I'm going to try and do my best to whip through this very quickly. I'd encourage any folks who are interested in learning more, including information about our local and regional activities across Canada, which I won't actually have any opportunity to get into in this talk, but please check out our freshly launched website at advance-avance.ca, and the link will be at the end. So in this presentation, I'm just going to provide a really brief review of Advance, including the background and history that led to our Pan-Canadian initiative, Advance's vision, mission, and values, a really quick overview of the Advance team and the 5 member organizations who formed the Pan-Canadian Alliance, and lastly, just a brief description of some of our core national programming priorities, our next steps, and some challenges that we've already identified. So just over 3 years ago, I took a position with Katie as their knowledge broker for gay men's sexual health programming, but the main motivation for that was actually the much anticipated funding model from PHAC, which unlike previous years, included an invitation for organizations with a shared interest, whether that be around population or geography, to collaborate together on a proposal. And this was referred to as the Community Alliance model. So one of my first tasks was to organize a 1-day meeting with various community, public health, and research stakeholders, many of whom are here in the room. What emerged from that was the identification of these 4 priority areas for national collaboration in gay men's health. When the PHAC call for proposals finally dropped, we quickly got to work around forming the group of organizations to be part of this Community Alliance. Folks who have been connected in some shape or form to the development of this particular alliance know that the process has been neither easy or smooth. But I think it's safe to say that the eventual outcome, which is a pan-Canadian coalition of buy-in for gay men's health and community-based organizations, was well worth the effort. And those organizations are Health Initiative for Men in Vancouver, ACT, formerly known as the AIDS Community of Toronto, Max Ottawa Réseau in Montreal, and of course CBRC, which plays dual roles in the project as a national coordinator as well as implementation leads in the Prairie and Atlantic regions. I have an asterisk next to Pan-Canadian because while the project includes resources and implementation for at least some activities in all 10 provinces, it doesn't currently include the North at all, which we acknowledge as an important limitation in calling ourselves Pan-Canadian. But the fact that we are more national and more Pan-Canadian than the vast majority of other national projects, I think is really important to keep in mind. And just the last little bits on that slide just sort of breaks down some of the key sort of activities that we've undertaken to initiate the project, like getting the 5-year contribution agreements in place, establishing the team, hiring staff and consultants, in the establishment of the core project mechanisms, so our governance and our communications, and ultimately the branding for this community alliance, which we landed on Advance with the tagline, Our Health, Our Wellness, to signify the community leadership aspect of this initiative and the holistic approach to health promotion that's reflected among our alliance. You know what, I'm going to skip to this slide first. So as I mentioned, Advance is an alliance of 5 leading community-based organizations who are dedicated to GBT2Q in Canada. Unlike HIM, ACT, MAX, and Réseau, which operate primarily locally, CBRC is represented in 3 different spots in this map to reflect its distinct roles in the Prairie and Atlantic regions, as well as its national coordination role. I won't review the full list of staff who are supporting the alliance at each of our organizations. But one thing that's important to underscore about this alliance is the significant new funding for dedicated full-time coordinators and managers across the country. These are new boots on the ground that didn't exist before the alliance, and so I think that's really important to keep in mind. In addition, there's a significant number of contract personnel who are set up in partnership with other community organizations and stakeholders, many of whom are located beyond the core sites of implementation of Halifax, Montreal, Ottawa, Toronto, Edmonton, and Vancouver. So I definitely don't have time to review this slide in detail, but I do think it's important to underscore the really ambitious vision that's been articulated around the need to improve health access and uptake for gay, bi, trans, two-spirit, and queer men in Canada, and including services that go beyond biomedical HIV and STBBI prevention. What's key to understanding the mission of Advance is our belief that a community-led response to mobilize evidence, tools, and leadership in partnership with stakeholders in public health, research, and community will affect the policy and practice change we need to ensure that our communities have better access to equitable and culturally competent care. So again, I probably don't have time to really get into the details of this, but this slide just kind of reviews some of our core national program priorities. So just around policy development and education, I think one of the things that makes our project unique is the fact that we are trying to undertake a really pan-Canadian strategy, and that's essential, I think, in order to address the patchwork systems of access that have resulted from our largely provincial system of healthcare in Canada. And so, you know, being able to address things like the fact that there is no point-of-care HIV testing available in Atlantic Canada, the fact that there are very significant differences in, for example, ARV access between provinces for both treatment and PrEP. Knowledge mobilization forms sort of a strong basis of our activities and our strategy in this alliance, and so being able to talk to different community stakeholders and researchers and policymakers around sort of identifying the gaps and how do we sort of mobilize the evidence that we know needs to get out there. And Sex Now, of course, that's something that was mentioned yesterday by Nathan Lachowski. This was an initiative that each of the Alliance members were heavily involved in and supported, just because I think we all recognize that if we don't have access to the right data, it's going to be really difficult to develop and cultivate that evidence-based response that I think we all know that we need. This slide just includes a couple sort of like ideas that I had around and thinking about the different programs that my co-presenters were talking about. I think when you think about this alliance, I like to think of it as a platform for collaboration. And it's really a platform to collaborate on a number of different levels for different types of activities. So around intervention development, I think, trying to think through how we can support and scale up the development of more structural and community level pilots. So, Totally Outright, I think, is a really strong example of, something that started small, but because, it just had so much success. I mean, I'm one of the first graduates and the first sort of peer recruiter for the project. The fact that I'm here today to be able to speak about this amazing project, I think speaks volumes about the fact that this is really an important intervention. And that's exactly the kind of approach to intervention development that we want to undertake. And just around supporting sort of like the knowledge mobilization, the evidence that's kind of gained through work that Trevor Hart and others have been sort of dedicated around in terms of understanding sort of what works, why, where, and how we can better scale up that work and make sure that the data that we get from these evaluations does kind of get translated into program implementation. So just very quickly, some challenges and next steps for Advance. So we recognize that Canada is a very big country. And so, we do want to broaden our alliance and, attempt to include the territories and the North. Being able to expand our work in some of the less resourced areas within our alliance, so scaling up the activities in the Atlantic and Prairie regions, meaningful engagement and representation of our diverse communities, so Indigenous and Two-Spirit people, as well as trans men and women, newcomers and refugees, people with disabilities, non-binary folk, people living with HIV and/or hepatitis C. And lastly, just to really build a truly collective and multi-sectoral response, we know that this is a very ambitious undertaking, and we have lofty goals. And in order to achieve those, we recognize that we need buy-in from a wide range of local and provincial and policy decision makers, new partnerships across the health systems, including mental health and primary and integrated health. So last slide is just thank you. This is a screenshot of our website, which we've sort of formally launched today. Please like us on Facebook, follow us on Twitter. You'll find lots of sort of articles, blog posts featuring some of the important work that's happening from each of the Alliance organizations. Thank you.